Hi, this is Julia Rush, and welcome to my final presentation and proposal for ABC Healthcare. So to give a little bit of background, ABC Healthcare is a large healthcare organization in the western United States, and they spent $20 million to purchase and implement a new electronic health record, an EHR. The goals were to improve patient care by enhancing communication and access among healthcare providers within the organization. So this organization has several healthcare facilities, one being an adult facility and one being a pediatric facility. The adult facility was the leader for this new EHR system, and the pediatric facility was made to follow behind without being included in the discussions, planning, acquisition, or implementation of the new system. So once this was thrust upon the staff members at the pediatric facility, they felt that the system didn't meet their needs or the needs of their patient. Morale quickly plummeted, and there were major frustrations across the hospital. This led the staff to develop workarounds, and the workarounds included charting on paper and then transcribing that into the chart later on. It led to poor time management, inaccessibility of the information by others until it was transcribed into the system, and it also led to safety breaches. So the intent of the new system was being skirted. So the proposal here is to refocus the implementation strategy and apply a new training and remediation program for the clinical staff. This would include obtaining staff input about the functionality of the EHR and finding out where the areas of the system were that the staff felt were deficient. The changes will then be made to the design of the system, and the workarounds will be eliminated, and the whole system, the whole project will be relaunched. So the needs that were highlighted here within the case of ABC Healthcare was the needs for a robust EHR, a quality and efficient EHR that led to quality and efficient information flow, patient safety, and staff satisfaction. So as we know, there needs to be a risk analysis done and a strategy here to keep the organization in line with applicable laws and standards. As we know, the HIPAA security rule is requires organizations to conduct a risk assessment. So ABC Healthcare will conduct a risk assessment in order to guarantee that the organization is compliant with the requirements of HIPAA, and also to look for opportunities that might be they might find to be able to help improve their system and their organization. The analysis will include evaluating the organization's administrative, physical, and technical safeguards. It will assess existing policies and procedures relating to limiting access, ensuring that only those who need the access have it. It'll look at usernames and passwords, making sure the passwords are solid, and also how, a system of a time frame for when passwords will be changed. Workstations and hardware will be assessed for security. For example, workstations will be assessed to determine if do they automatically log off after periods of inactivity. Systems backups will be considered, downtime procedures will be considered, emergency procedures will be looked at, audit reports will be generated and evaluated by leadership, and when there are lapses found, that will be addressed. Ongoing security and awareness training will also be evaluated and fine-tuned as deemed necessary. So the assessment of the essential components of healthcare decision-making models, especially as it relates to the system development life cycle, are here at ABC Healthcare. So decision-making models help healthcare leaders to follow a step-by-step process to make good quality decisions that enhance care, create value, and reduce waste. The first step in the system development life cycle is planning and analysis, which this revolves around the problem and or the initiative that the organization is trying to solve or achieve, and it's always in line with the strategic goals of the organization. The design phase is the second stage of this life cycle, and it considers the various alternatives to the organization in terms of system acquisition. For example, what are they looking for? Are they looking to build their own system? Are they looking to buy a ready-made system? Are they looking for a cloud-based system? This phase looks at all the viable options along with their costs versus the benefits, and it attempts to choose the best system to meet the needs of the organization and solve the problem at hand. The third phase is the implementation phase, which was a major failure for ABC Healthcare in the system development lifecycle. This phase occurs when the new system has been chosen and all the business agreements have been finalized and the system is ready to move to life. Perhaps had this stage been looked at a little bit or a lot more closely, this problems that ABC Healthcare found itself in could have been minimized. The fourth and final stage after system implementation is up and running and functioning is a support and evaluation phase. This phase is equally as important as the other phases, and it provides ongoing support of the new system in terms of staff support, upgrades, managing technical problems, and working to avoid downtime and working to remedy downtime when it occurs when it's unplanned. The support and evaluation stage remain in place in the life cycle until it is time to replace the system with another. When this time comes, the life cycle is considered over and a new cycle begins. The determination of the impact of technology on cultural factors in healthcare provisions and decision making. Technology can have an impact on cultural factors in healthcare provisions and decision making. There are cultural factors of organizations that include the organization itself, the employees, and the patients themselves can have an influence on this. So technology has increased the demand for quality in many industries, and healthcare is no exception. Many people in the United States have access to mobile devices, computers, and the internet, and they use these technologies to search for answers to their healthcare needs and to double check what they've already been told. There are also socioeconomic and socio-demographic variables that can impact technology and the quality of care that can be that can make desired outcomes difficult. Even though the goal of technology in healthcare is to improve care, it still can come with challenges when dealing with culture. So patient culture, education, and responsibility can greatly impact this quality of healthcare. Healthcare providers need to be culturally competent and aware of these variables. They need to take into account the variables that go into the technological ability of their patients, and they need to tailor the needs of their patients with their culture, the patient's cultural background in mind. Healthcare organizations and professionals can use technology to improve the delivery of care to the extent that the patient is able to personally benefit from it. So the evaluation of the roles and responsibilities of key players in strategic planning and continuous quality improvement. Strategic planning and continuous quality improvement is complex, and there are various key players that need to understand their roles in this complexity. Strategic planning is essential for the overall success of an organization, and there are roles and responsibilities that each of these players have. So I've listed here some of the players being the board of directors and the CEO, the CFO, the chief financial officer, the chief nurse, the chief medical officer, and the chief information officer. All of these players are responsible for planning and directing the various activities and goals for the specialties that they represent. The development of relationships with stakeholders such as medical staff and patients and insurers is also key in the development of a strategic plan because their input and perspective are invaluable. Patient input obtained via patient satisfaction surveys and intentional bedside rounding can also aid in continuous quality improvement as well. Enterprise-wide data role in health information governance. This sets the framework for managing health information by meeting the needs of secure data collection while extracting value and information from it. Enterprise-wide data can help organizations improve patient care and reduce costs. When health information governance policies are in place, organizations can safely gather, revise, adjust, store, retrieve, delete, and ultimately use data as information for practice and improving care. Enterprise-wide data necessitates continuous monitoring, and health information governance provides a framework for data management so that organizations can gain value in a secure and compliant way. The roles of technology and enterprise-wide information as it relates to data governance. There is accuracy, reliability, usefulness, and protection of data. Risks that can be involved in this usually revolve around human error, which lead to data breaches, failures, and failure to protect the data. When there are failures within an organization to secure and manage the flow of data into and out of the organization, and who can assess it, technology's role can actually fail. Moving on to best practices and policies as they relate to data governance, information exchange, and technical and structural interoperability. These are all vital aspects of health information systems, especially in the United States. The ability to efficiently capture and exchange health information while remaining legally compliant, reducing costs, and improving care is at the forefront of healthcare, the forefront of the healthcare world. So the explanation of the economic impact of the proposal here for ABC Healthcare, the proposal is not to acquire a new system. It's to improve the current system and make revisions to make it useful for the organization. So there will be resources needing to be allocated in terms of financial resources, which includes funding for vendor support, funding for redesign, training, extra support. Overtime will definitely be expected in this because the staff will need extra time to complete their tasks. There will be, in addition to the money that needs to be spent, there will be an economic benefit by reduced risk, greater efficiency, and staff retention in terms of staff satisfaction. So the board is going to want to know the answers to a few questions. They're going to want to know what led to this problem in the first place. How will this plan safeguard against a repeat of what was just experienced? And what is the value that will be added to the organization if we follow the proposed plan versus mandating that staff use the system as it is? So we already discussed what caused the problem in the first place. It was a failure of implementation and a failure of input by the end users, basically. The plan will safeguard against this from happening again because it will step back and correct the problems that should have been addressed in the first place. And lastly, the benefit or the value that will be added to the organization will be both tangible and intangible. There will be a greater efficiency of flow of information that is going to be accessible to providers. There's going to be time savings, improved patient safety, and staff satisfaction. Not all of these aspects have a dollar amount attached to them, but the rewards and the return of the relaunch will be priceless. So to conclude, there are enormous challenges that faced ABC Healthcare early on from these failures. Evaluation of the issues has happened. A new plan has been formulated. A careful re-implementation plan should be launched, and the benefits of the redesign and the re-implementation will be great. Technology is a great tool that, when built and used properly, can help an organization improve flow of information that can positively impact the safe delivery of patient care and make patient care more effective, cost-wise and satisfaction-wise. And bottom line, we're all here for patients and for patient care, so that's what we need to be about. Thank you for your time and attention, and have a good evening.